the average dentist is going to work dealing with dental insurance, then that should be a class in school. And if the average dentist is going to be a practice owner at some point, they should get some information on what that looks like from a tax perspective, from how do you actually read a P&L, because you're not taught business in high school. You probably didn't take a business class in college if you're majored in some science class to be a dentist. And so the first time a doctor is looking at a P&L is when their CPA is giving that to them, and they're like, what the heck is this? And I don't know what to even do with it.
Welcome back, everyone, to another episode of the Dental Truth Project. We are super excited to have Dr. Rehan Shahid to guest with us today. But before we introduce him and get into our dental truth, we need to have our Ask Ken segment. You want to take that away, Ken?
So excited for this one. This is a great question, and we could go on probably for hours on this one. The question that came in is EBITDA manipulation just part of the game? Now, again, we could go down a lot of different rabbit holes here, but I'll try to keep it at this. The number one thing that you should care about if you're thinking about your enterprise value, you're thinking about going to market, the number one thing you should think about is accuracy, not what is your EBITDA initially. And the reason why is because whoever comes in and does a quality of earnings statement, or whoever the private equity firm is, when they come in, they're smart. They know where you're going to be trying to hide things if you're that type of person. And I'm going to tell you, it will blow the deal up immediately if they see, and it sounds anything like you're trying to do some type of gamesmanship around what your EBITDA is. Ultimately, the number is what it is, especially if you're on accrual accounting and you're doing things the right way and everything's organized the right way. But do not try to play gamesmanship. You will never get a deal done if you go down that road. And if you do, and later on they find that you were gaming them, it's just going to be a really, really big mess. I've actually seen some deals completely unwind after the merger happened and everything came together. All right, I'll pass it back over to you, Dallin, for the episode.
Yes. So as we said before, we've got Dr. Rehan here. So we'll turn it over to you to introduce yourself, give us just a brief background, who you are, what you're doing in dental, and then go right into the truth that you think the dental industry needs to hear.
Well, thank you guys for having me. My name is Dr. Rehan Shahid. I'm a dental coach and a multi-practice owner. And what I do is I like to teach dentists on how to buy back time and scale their company. The biggest dental truth that I've found out from experience now is that the business side is way more important than the clinical side, and not many dentists know that. And over time, just with seeing stuff, you guys in the financial realm, you guys see the business side too. So I feel like that's something that most dentists, you don't get taught that in school, and it's a bigger thing that we definitely need to focus on.
We can dig into this. This is good. So help us understand a little bit more about your journey, because you're a dentist, and we were talking before, you're still a practicing dentist, still have a couple days in the chair that you're doing each week. So what did it look like for you leaving school, and how did you come to this realization?
And so I was a COVID grad. And for those that don't know, that's graduated in 2020. Everything was closed. So we kind of, as dentists, got chipped out on our education. And the shiny object in that time was everything was closed. So you were stuck at home and you had the opportunity to go study or go learn something. So for me, that was, hey, well, I can't do clinical stuff. I want to be a practice owner. Let me go learn how to be a practice owner. And so that was my journey from graduating. When I had these months off, I learned and I just absorbed everything from podcasts to books. There's probably 200 something books behind me that I've read every single one of them. It was just, how do I just become the business guy? Because dental school is going to teach me the dentistry. And that experience then let me dive into the business realm. I got to learn more. I got to meet people, and I started just opening my mind to the business side was what really makes money, right? Clinical dentistry doesn't make money. The business, the leadership, the operations, the systems, the financial component, all that is the moneymaker. And you can't succeed if you don't have that nailed down.
Outstanding. Yeah, I love this because I've always said, I've never met a dentist that wasn't intelligent, but I have met a lot of dentists who really struggle with the financial side of running a business, especially their dental practice or group of practices. And without much education or experience in those areas, I mean, you're a novice. Regardless of how smart you are and all the schooling that you've gone through and everything else, I would always want to advocate to try to give dentists in dental school even a little bit of exposure to business and those kinds of things. What are your thoughts on that?
Yeah, I agree. I question why we don't do that in the first place. It's, if the average dentist is going to work dealing with dental insurance, then that should be a class in school. And if the average dentist is going to be a practice owner at some point, they should get some information on what that looks like from a tax perspective, from how do you actually read a P&L, because you're not taught business in high school. You probably didn't take a business class in college if you're majored in some science class to be a dentist. And so the first time a doctor is looking at a P&L is when their CPA is giving that to them, and they're like, what the heck is this? I don't know what to even do with it. So we definitely
Yep.
miss out in dental school.
We see that a lot. So what are you trying to do right now to solve for this? Because you mentioned that you run a dental coaching company. So what is Dr. Rehan doing to try to address this problem?
So I'm starting from the top as the CEO. And what I've done is I've treated my dental company itself before I ever did coaching as a business from the get-go. Meaning, if you look at any major multi-billion-dollar business, there's a CEO and there's a C-suite, and everyone runs on data-driven decisions. There's not really any subjective decision making in that business process. And so what I did is I developed my company to do the same thing. There's a CEO, which is myself. There's an operations person, and there's department heads, and everyone knows exactly what to do, what KPI they're graded upon, and anything related to what their role implies. And when I saw that succeed in my own company, I then said, hey, if I could do this, the average dentist is not doing this. How do I get them to understand that this is a thing? And so from there, I started working with dentists and just teaching them, you have to be considered the CEO of your office, not a practice owner, because those are two different things. And a lot of people think being a practice owner means you're the CEO, and it doesn't. And so my big step was making that mindset shift was step one. When you wear the CEO hat, you automatically make decisions based on metrics alone, not, well, because Susie didn't like doing it, so we switched to something else. And that process of mental mindset shift started shifting the game for a lot of dentists that I've worked with.
Super interesting. What I think is fascinating about your story is that you graduated from dental school. You're not able to practice clinically. And so you go seek out business education on your own. So then when you are able to begin practicing dentistry and you're opening up your own location or several locations, you are putting the right foundation in place.
Yeah.
I think what we've seen a lot of in the dental industry is dentists that are fantastic dentists and excel clinically. Patients love them, like just producing, doing awesome. And so they open up a lot of different locations. And then all of a sudden they have this bigger group that is big enough to be a big boy business and ought to be a big boy business, but it's not being run like one because that foundation wasn't laid. And you as the dentist are saying, no, from the very beginning, I laid the foundation. I set it up like a real true business. And that has allowed us to grow and excel.
Yeah. And I think you have to do it that way because at the end of the day, we are a business, right? Medical is different than dental. Medical doesn't have to sell. Dentistry, you actually have to convince people to buy things that they're not in pain with, most likely. It's not bothering them and they can't even see it or even feel it. And that's selling. You're selling value of what you're doing. And you have to convince people to do stuff like that. That's an additive. Like people don't need cleanings. We have to sell the value of that. People need heart transplants. So the medical side doesn't have to do a realm of business, but the dental side has a lot of it. And because it's a small private practice, it's a small business within a business that you have to learn how do you actually operate it to make it go to scale.
So what are some of the key components of this group that you have, this training that you're doing with other dentists? What are some of the sort of foundational pillars of how you try to take them through this and educate them on all of these really, really important items?
The first one would be mindset always. You have to just be able to be coachable. When we walk out of dental school, we're like, we are now officially dentists. We know everything. And reality hits really hard when you're like, wow, I didn't know that I actually had to do all this stuff. And so it's a mindset shift of you have to be coachable. You have to be a sponge and say, I know nothing and I'm here to learn. Then the next thing is really relying on metrics, KPIs, scorecards, and really operating like an actual business says. And I'm not the first person that's coined that term. I like to say, there's a phrase I like to use, don't reinvent the wheel, copy genius. And if you look at every single successful billion-dollar company or even multi-million-dollar company, they all have the one big characteristic that's the same, which is they all drive decisions through data. So I think if an office or a dental company is not working with measuring their data, then they're already shooting themselves in the foot and they're just kind of going in blind. Kind of like a dentist going in, diagnosing without an x-ray, you have to have something to look at to know what is success even as a reference point.
So tell me about a couple of the pillars that you use to teach how to be leaders with people. Because again, somebody who goes to dental school isn't necessarily taught how to lead people and how to manage them and how to help them grow and within an environment that, would be their dental practice. How do you guys take that on? What are some of the principles you guys try to follow there?
I follow two concepts from two amazing books. One is called Extreme Ownership, and the other is called Crucial Conversations.
Yes.
So Extreme Ownerships, and for those that don't know, it's pretty much a book that changes your mindset to assume everything is your fault. And so if a patient cancels because, let's say they didn't fill out their paperwork, before the dentist goes and runs to the front desk and says, hey, it's your fault, put the extreme ownership mindset hat on and say, it's my fault. What could I have done to fix it? Well, I could have maybe established an SOP for call confirmations. Do I have one in place or not? And so that mindset shift makes the leader now a better leader by assuming everything is your fault. Now let's stop putting the blame game on and let's figure out how do we actually get solutions from there.
I did read that book, and I think I still have a little bit of trauma from Jocko's story after story after story on the battlefield. So it's nice to just talk about it in this environment.
It does go into more of a military perspective, but the key points are really good in there. And the second concept in leadership that I talk about with dentists is crucial conversations. And the best way to describe that is the booger in your nose. As humans, if you had a booger in your nose, I would do you a disservice if I didn't tell you about it. Right. And so the concept is the same for team members. If we know they're not doing well, as an average dentist, we are not confrontational. So we don't tell that person and we hold it in, and then it's like a balloon that just pops over time. It only gets worse. It doesn't get better. And so if you're able to go in with that mindset, hey, I'm going to help you by pointing at the booger in your nose and it's not an attack. It's really to help you. Having that crucial conversation with your team when you know they're not performing allows them to help you help them. Right. And so we have to be able to adapt into those two mindsets to be able to lead better over time.
Yeah. Again, these are skill sets that aren't taught in dental school. And so you've got to pick these up. And I've seen some dentists who gravitate really quickly toward it and it just naturally happens. And then I've seen some that just really struggle with it. And the entire team struggles as a result because they're not getting the right communication to be a good team player.
Yeah. And it's just asking for feedback. As a dentist, if you expect your team to perform for you, there's an expectation of them for you and how you should perform. Asking for raw 360-degree feedback allows them to be able to give you feedback on how you could be a better leader.
Yeah, so true.
I'm also going to point out these are concepts that aren't really taught in many college classrooms. And I'm relating to you here, Rehan. I've read, sounds like many of the same books as you, and been absolutely transformed by them. Extreme Ownership is one of my favorites. It's at the top of my list. It almost like learning leadership, learning business, learning how to be a good manager. There's some of it that's covered in a college classroom, but a lot of it only comes if it's knowledge that you are hungry for and if it's the kind of person that you want to be. I love that for you, you're almost a self-taught leader. You're a self-taught businessman. You didn't get an MBA. You didn't get an undergrad in this.
I got an MBA, but that was an addition.
Mm-hmm. But I mean, it sounds like your main education was just good book university, like seeking out knowledge in what other people have written and really trying to educate yourself on.
Yeah, and that's the concept of collapsing time. The definition of a coach, essentially, right? Beyond the books, taking courses, going to meet people that are better, stronger in every single way, and just learning and being a sponge. And now over time, I feel like I've cracked the code. Am I perfect? No, not even close. But am I a far enough level to where I've surpassed my goals? Yes. And can I help people? And I think, it's like, people know that the number one way to lose weight is to go to the gym. And that's also the number one book written in the world, how to lose weight. But most people aren't, perfectly fit. And so it's not a lack of information that's out there, right? You could go and type on YouTube, leadership and be a better leader. It's the implementation part of it. It's the accountability and the coaching part that really helps the guy lose weight. Having the fitness coach is naturally proven to show that you'll lose weight compared to doing it on your own. And I think that's where, people like me come in, or just content in general. The information is there, but someone has to be able to grab it and coach it so then you can run with it and actually implement it.
So, Dr. Rehan, I've got a question here, and I think we're probably getting close to needing to wrap up, but especially in the early days of you getting a vision for yourself and starting to move forward, how much of the learning was trial and error?
Almost all of it. So I think
that's what I suspected. So I'm glad we called it out. Like, it'd be great to hear how you approach that.
Yeah. So I'm a big fan of Alex Hormozi, and he talks about, let's just assume you're going to mess up in life a lot. Go ahead and get the reps in of those mistakes so you can just get to the end result of now knowing what to do. And so knowing that, I was already in the game of, I already know I'm going to mess up. Let me just go and do fast execution and get me a rough version of what I'm going to get. So then I can go and revamp it and make it better. And that's the experience, right? No mistakes learned, lessons always learned.
And would it be fair to say that to some degree, people who go into dentistry can have a perfectionist mindset and therefore sort of get just jammed up and they just can't seem to get the cogs moving forward because either they're in their own head or those kinds of things? Do you have any comment on that?
Yeah. I call it analysis paralysis.
Yeah.
We as dentists, we're type A people where everything has to be perfect. You can go into an operatory, if the burr is not perfectly placed into the drill, then it irks us as a dentist. And that analysis paralysis is what holds many dentists back. They want everything to be perfect, and life's not perfect. But life has been proven, those that execute fast get more successful because you can revamp on the way, versus analysis paralysis holds you back from ever even getting to even remotely close to what that goal was.
I love that. Sometimes you just got to do it.
Yeah,
even if it's wrong.
Nike, just do it.
Yep. Just got to do it. Cool. Well, thank you very much for joining us for this excellent conversation, Dr. Rehan. Do you have any final thoughts that you would like to share with our listeners?
I think just collapsing time is a big component in life of success. Whether, someone wants to engage in a conversation with me on how I coach people or a coach in general, I think if you have the opportunity to save yourself time instead of going through all the mistakes by people that have already been there, done that, then the value of that is way more than the value of not doing it. And so that's a mindset shift. And when you adapt into that, you start running towards success instead of just crawling to it.
I love that. Thank you. If any of our listeners want to contact you for more information or just to talk, if they're interested in your coaching, what's the best way for them to do that?
They could follow me on Instagram at Practice Success Academy.
All right. Sounds good. Instagram it is. Thank you again, Dr. Rehan, for joining us. And we will see you all next time on the Dental Truth Project.
And thank you for having me.